In my previous videos, I promised myself to show some very cool microscopy videos with samples that are very cool in their own way. Then I finally committed to myself and now I will show microscopy of two commonly observed samples in a clinical laboratory. That is a urine and a semen sample. So in today's video, I will perform urine RE and semen analysis. In one of my previous videos, I performed a urine CS test to check for a possible UTI in my urine and it came out negative. Another ways to figure out a UTI or a common infection in your bladder or kidneys, a test is also done called a urine routine examination or a urine RE for short. This is a very old school method used in a clinical analysis for a very long time. The test involves three main steps, that is physical examination, chemical examination and microscopy. So the first step is physical examination. To do this, I got out my own urine sample in a beaker. Just by looking at its color is pale yellow and it remains normal. Any form of turbidity or deposit like urine being cloudy or presence of blood shows an infection in your bladder. The next step is to check for chemical examination. This includes testing for three main things including glucose, protein and pH. For this purpose, a Combi 3V strip is used. Just take out one and dip it in and take it out. Let it sit for about 1 minute. I also dipped in a Combi 10 strip and let it sit for about 1 minute. After then, I compared it and the Combi 3 one shows negative glucose or a trace amount or 1 plus protein and an acidic pH, which in a clinical routine is normal. If a trace amount of glucose is shown, then it is also normal, except a 1 to 3 plus sugar can mean the patient has a relative amount of glucose or be diabetic. A trace to 1 plus amount of protein is also normal, but a 2 to 3 plus can also mean the presence of a moderate to high amount of protein in your urine. Then a normal pH of urine ranges from 4.5 to 8.0 with an average around 6.0. pH less than 6 can be acidic and resemble acidosis, while a pH more than 7 is alkaline and resemble alkalolysis. If the pH remains acidic, then it can resemble presence of amorphous urates, while if the pH remains basic, then it can resemble the presence of amorphous phosphates if the urine is cloudy. Well, this was all about chemical examination. Now I also want to test it for my presence of glucose. So in a tube, I added about 1 ml of sugar reagent with about 300 microliters of urine sample. Then I boiled the mixture for 30 seconds. After letting it cool down, I checked its color and the solution shows no color, meaning that this result is negative for any sugars to find in my urine sample. If the color changes into a nice pink color, then it means the sugar is present. The final step is microscopy. So I poured a small amount of urine in a test tube and centrifuged it for about 1 minute. Then I took it out and discarded the remaining urine and shaked it well. Then I placed 1 drop of urine onto a glass slide and applied a cover slip. Then I lowered the sample into the microscope. Upon observing that there is no presence of cells except some pus cells, which is about 1 to 2 cells in per field, which is normal. Just in case, I took out some pics of an abnormal urine of Gemza stained. Here we can see some epithelial cells along with some bacteria. And here are some stained pus cells under the microscope. The commonly seen cells in a urine sample are like pus, RBC, epithelial cells, deposit things like mucus thread, bacteria and amorphous phosphates or urates, casts like granular cast or hyaline cast, crystals like calcium oxalate or calcium phosphate. These fields in particular shows the presence of epithelial cells for about 6 to 8 to 10 pus cells and 3 to 4 RBC, including rod-shaped small bacteria and presence of a mucus thread like MT. So for a urine report mentioning these can resemble infections or problems with bladders or ureters, commonly in lower UTIs and less common in upper UTIs. My urine, however, is normal and I don't have any problems with my bladder. Well, this was all about urine RE. Now let us talk about semen analysis. Semen analysis, also called a sperm count test, is a laboratory evaluation that measures the quantity, quality, and overall health of a man's sperm and semen. It is primarily used to check for male infertility or to confirm the success of a vasectomy. This test involves evaluation of several parameters, including sperm count, motility, morphology, volume, pH level, and liquefaction time. Doctors usually ask you to avoid sexual activity and ejaculation for about 2 to 7 days before giving the sample. So, just to be safe and not to be judged, I got out a sample from a patient. I am not going to tell the person's name or personal details to keep it confidential. First is the liquefaction time. The semen is kept at room temperature or an incubator for 15 to 20 minutes to liquefy its consistency from thick to being thin. Then it is further examined. If the semen remains thick after 20 to 25 minutes, then it is hyperviscosity, which slows down sperm movement, which can sometimes be a sign of underlying infection or a small health issue. There are several reasons for this, like prostate problems, infections, or dehydration. This sample liquefied in just 15 minutes, which is normal. Then I swirled it around and added about 15 microliters on a glass slide. Then I covered it up and loaded it into the microscope. At 10x, we can see sperm count, which overall shows normospermia, which is more than 15 million sperm cells per ml. Other conditions like oligospermia, where sperm is less than 15 million per ml. Azoospermia, which lacks any presence of sperm cells at all. Cryptozoospermia, which is extremely low sperm count, found only after centrifugation of the sample. Necrozoospermia, which is all sperm cells are dead or non-motile. At 45x, we can see 55% active or rapid sperms, 25% sluggish or non-progressive sperms, and 20% immotile or dead sperms. Overall, 60% normal and 40% abnormal sperms, as this was all about sperm motility. And now we will talk about sperm morphology. A normal sperm morphology features a smooth or oval shaped head 5 to 6 micrometers long, with an acrosome cap covering 40% to 70% of it, a slender midpiece, and a single long straight tail. A more than 4% normal forms is considered to be normal. Common defects includes giant tapered or double heads, but midpiece or coiled double tails. To observe this, a special type of stain called HOG and EA stain to see sperm morphology. First, the sperm is mixed again and a small amount is placed onto the slide and it is smeared to the end. After that, it is left to dry and fixed with 100% ethanol, then 50% ethanol. Afterwards, a hematoxylin stain is added for about 5 minutes. Then it is removed and washed and acid alcohol is added for a few seconds. Then OG6 orange stain is applied for 1 minute. Afterwards, EA50 stain is applied for 1 minute. Then it is yet washed again and let dry. At 100x, I found some sperm cells, but I couldn't see them much properly, probably because I was supposed to wash between OG and EA50 stain, so I redo it and this time I see it much clearly. Here we can see its head and tail. This morphology also remains normal and as normal sperms seen according to more than 4% normal headed sperms is considered to be normal. Now, as for total amount of dead and alive sperms, a stain is applied called ENN stain. So into a tube, I added about 200 microliters of semen along with 100 microliters of eosin stain. I mixed it well and applied 100 microliters of nitrosin stain. I mixed it again and made a smear out of it. At 100x, we can count each and every sperm. If the color is white, then it means it's alive. If the color is pink, then it means it's dead. Overall, counting in each field, the average is about 70% alive and 30% dead sperms. I also did a fructose test by adding 300 microliters of semen and 1 ml of reagent. After boiling, it changed its color to pink. A side-by-side comparison as the urine one remained negative and this one is positive, meaning the semen is in normal findings. It proves that your seminal vesicles are present and working right to make sugar that gives sperm energy to move. A negative result shows a blockage or a missing gland. Well, this was all about semen analysis. I hope that you learned a lot. In future, I also plan to make other videos based on your thoughts, and if you have any other thoughts, then definitely let me know down in the comments. I hopefully read them all. And if you like watching videos like these, consider subscribing and liking my channel, and I will hopefully see you in the next one. Thanks for watching.